If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and it's great to be with you today. This is the finale of our 17th season. As you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. It's more important than ever to become an informed patient, and we're here to bring you timely health discussions. Now, for those who are new to the show, there are two ways to get in. One, you can call the live phone line at 718-499-6101, or you can email questions to askthedoctor@netny.net, and we'll bring them into discussions. Now, I want to let you in on a little secret about tonight. It's a special episode. In addition to our on-air assistant, Kirsten Elizabeth, and our guest doctors, we have a few surprise guests and surprise contents. Kirsten, how are you?
I'm great, Dr. Garner. I'm so excited for Thanksgiving.
What about tonight's show? I mean, my pulse is racing.
Me too. This is a very special show we have tonight. I'm so excited for it.
Are you doing the cooking, by the way?
Oh, no. I'm traveling to Florida tomorrow. I'm going to count on my in-laws to do all that.
Smart, smart. So, but I'm really, I don't even want to delay this banter at all. I wanted to, we got to get right to this excitement now. Before, one last thing. Let's take care of business. Do the quiz for us. Tell us what the quiz is.
You ready for the quiz? Yeah. All right, you got it. So, the Thanksgiving holiday is a great time to get together with friends and family. And lately, it also marks the start of the shopping season. This attention to finance is not so new. In fact, one president actually changed the date of the holiday to boost the economy. Now, the quiz question is, can you name the president who did this? And, you know, also in keeping in the spirit of the holidays, could you please sing a couple of verses of your favorite Thanksgiving or Christmas song that you will be singing with your friends and family around the Thanksgiving table this year?
Thanks, Kirsten. I know, I heard a song around my table called We Gather Together to Ask the Lord's Blessing, and nobody seems to know that one. So if anybody out there knows it, please vindicate me.
Definitely.
Okay, it would be nice to hear you sing that. Now, it's great to see Monsignor. Hasn't missed a show. Probably 17 seasons, Monsignor missed one show. Would you do it? I know you never like to come out. Would you come on stage, please? Monsignor Bennett, making a very rare live appearance.
Surprise, surprise.
Monsignor. Well, I know so many people wanted to see your face because they hear you every week, and they wanted to see, who is Monsignor Bennett? What does he look like? And
I hope they're satisfied.
Very handsome.
Well, Kirsten says very handsome. So Monsignor, anyway, tell us a little bit about what's been going on. I know this hurricane has been amazing, what it did.
It's been terrible. And the coasts of a number of the states have been ruined. And it's tragic because the people have houses that burned down, that there's nothing left at all.
Anything happened to the boat basin in Sheepshead Bay?
Sheepshead Bay, we found out with all the stuff that was left in the porch of it, there's a couple of sailboats. Nobody knows who owned them, but the sailboats are in good shape, but it's just standing on our grounds.
Now, Monsignor, just to fill you in, I know I've talked about this. I always talk about restaurants. We both love the River Cafe, and with my wife Ann and Monsignor and myself, we go to River Cafe once a month, and that was a victim of this hurricane as well. It's gone.
Terrible. There was a big article in the Times about it, and it's going to be a total change. But they say they want to reorganize this local thing anyway.
I hope it happens. Buzzy O'Keefe, I know he watched the show actually occasionally, so it'd be nice to have him back on. I know. Tell the people what you do in your spare time. What you do in Colorado. Is it Wyoming or Colorado? I get those
Wyoming.
I get the two mixed up. I don't know.
Wyoming. Oh, we go into the wilderness areas on horses, and there's no houses, no buildings, no roads, no anything, and the only way to get in is on horseback.
Yeah.
And fortunately, I'm the dude from the east, and I ride very easily. So I go with 3 priests who live in Wyoming, and we go into the wilderness areas.
I know you also you used to ride the horse in Prospect Park as well, and
Yes.
Monsignor's a great rider. And also, didn't you once do skeet shooting with some guy from the middle of the country thought he could beat you?
Oh, that was on a Graceline tour
Yeah.
with my mother and sister. One of the things is the skeet shooting, and there was a team for the champion shooter on the boat, and I ended up shooting against a big Texas
Big Texan. They're all big
cowboy,
Texans. I don't know.
and the shotgun looked like a pistol to him, and it turned out that I was the one to win, and he
Again. So Monsignor, we got to go. We want a blessing. We want a blessing for the show, for the audience, and
Yes.
for those who are most hard hit from this storm. Could you?
Sure. I would like to say that we should be realizing that the Thanksgiving Day is not necessarily the whole interest in it is to eat a big dinner. We are talking to a Thanksgiving to whom are we thanking, and that is God our Father. And so I think it'd be proper that we could bless you and you could in your mind follow it. O Lord God our Father, we are your daughters and sons. We thank you for everything you have given us, our life and all of our things that we do. And we ask you to help those who need you and haven't yet found out that you are there on their side. And we thank you for everything, and we thank you for the dinner we're going to have, because many people, even in our own state now, at Thanksgiving this time, there's nothing much they can eat yet, and that is a tragedy. We thank you, God, and we ask you to help those who need you. Amen.
Amen. And Monsignor's the sole reason that we're still here now. He was the president of the board of this organization that runs the TV station. He put this show on the air, and he's been a staunch supporter. So, Monsignor, thank you for everything. Thanks for being a great friend.
He's a great friend.
Thank you.
Wonderful.
Now we have another interview that I did with Dr. Sherry Schachter, and she works at the Calvary Hospital and in the Bereavement Center. And I didn't know a lot about this. I said, how are we doing bereavement, Thanksgiving? Why don't you listen? This is, you'll see the way the two are connected, and we'll learn about how Calvary offers programs to help people continue after a loss. Let's watch the interview. I'm here with Dr. Sherry Schachter. I'm Dr. Steve Garner, and we're here today to talk about an important topic, bereavement. Something that in the past, we were just talking about that, I had an entirely different thought about that. Tell us some of the misconceptions, please.
I think some of the misconceptions today are that there's an understanding or a thought that we need to get through our grief in order to move on with our lives. And research has shown that that's not the case. We continue our bonds with our loved one and talking about them, memorializing them, spending time grieving is actually quite healthy. And it's not moving on with one's life, it's carrying on in a healthy way with one's life.
Now, when we talk about bereavement, is it only about human life, or could there be other losses that may...
We have many losses in life. My specialty for the past 35 years has been losses related to death. But clearly there are many losses in life, relationships, divorce, moving, adoption, many losses, and loss of a job that are significant losses in life. But my specialty is actually human loss.
I want to get to how the people can access this service. But first I want to know, does it take its toll on you, 35 years of dealing with bereavement?
Do I look depressed?
No, no.
No, I'm not. In fact, it hasn't been a toll on me. It has given me a way to really raise my family. I have 5 kids, and what's important in life and what's not important. I think being a clinician working with dying patients and with bereaved family members is really very special, and it's a gift that they give me.
And you work with a special organization, Calvary Hospital.
Absolutely.
How do these two overlap or have the same philosophy?
I'm the director of bereavement for Calvary Hospital and for Calvary Home Hospice Program. And the way that they overlap is, the mission of Calvary, one of our core principles is non-abandonment. And so we view the family.
What is that? Tell the audience what that means.
What non-abandonment
Yeah, what
means?
does that mean?
It means following families, following patients, not leaving them at the end of life. And we carry that to our families as well. And so after our patients die, we follow their families for 13 months in many different ways, by sending them information on bereavement, by offering bereavement groups, as well as individual help.
I mean, if you have somebody who's, let's say in Calvary, in a hospice program, when is the time to get you involved?
My role actually starts once the patient dies. The role at Calvary, we actually have our chaplains and our social workers work with families before the death. The bereavement program that we offer in Brooklyn as well as in the Bronx is open to everyone in the community, though. It's not just the family members of Calvary.
Is it open to any religious group?
Absolutely. Any religious, any type of death. Our groups are non-faith based. They're theoretically based, which is, I think, important to know. Our groups are free, and they're open to anyone in the community, as long as it's been a recent death, recent within the past 18 months or so.
And what about the tragedy of the Hurricane Sandy and the people that died? And do you get involved with any of those areas?
We do a lot of community work, and so yes, over the years, whether it was 9/11 or certainly now with the devastation from the hurricane, absolutely we work with families in the community as well.
Is there a difference dealing with children, adults? Does anybody specialize in bereavement for children, bereavement for elderly? So on?
Our groups are very specific. So our adult groups, here in Brooklyn, for example, we offer groups for the loss of a parent and also groups for loss of a spouse or a partner. And those groups are held in downtown Brooklyn at St. Francis College.
So how do I get in? How does somebody get into this? What's the access? How do you get into the bereavement?
You just contact the hospital and set up an appointment.
Like, let's say someone's at Calvary Hospital. You contact Calvary and say, I want to get bereavement involved?
I need some bereavement help, whether it's community or an individual. Sometimes schools will contact us and ask for help. We go into schools because we run 2, 4, 6
I want to put up a number on the
groups.
screen how they can access. Is this only Calvary, though? You don't take...
No, we're open to the community.
So if New York Methodist Hospital has somebody that needs help, you get in?
Absolutely, absolutely. Both for our children's programs, our summer camp, as well as for the adult groups.
What about insurance? How do you pay for this?
We don't charge. There's no charge for bereavement services. So our services are free, and they're open to the community.
Did insurance ever think of covering bereavement
No,
practices?
has never been a factor at Calvary.
Amazing.
All of our services, bereavement services, are free.
So we're dealing with people who've had a loss, who are mourning, and it may go on for a while. Different people mourn different amounts of time,
Absolutely.
right? Maybe a year, maybe half a year. If you're in that and you're having trouble, or even if you're not having trouble.
Or you just need some extra support.
So here the people are out there. Tell them how they could reach you.
Contact Calvary Hospital at www.calvaryhospital.org.
And this could be from any hospital, from any location in the city.
Absolutely. Or Westchester or Long Island.
Calvary's a remarkable place.
It
I mean,
is
it's
a
just
remarkable place.
just outstanding. I can't thank you enough for the services and for coming here to tell our audience about it. Again, it's part of life. I know we have Thanksgiving come up and we have a fun show ahead with some music and so on, but amidst the music, there's always
Absolutely.
a little sadness.
There's
So
bittersweetness, yeah.
thanks so much for
You're
coming.
quite welcome.
Great to meet you.
Nice meeting you.
Bye.
You are watching NET.
And welcome back to Ask the Doctor, and thank you once again, Monsignor Bennett. I know all of us, wasn't it amazing to see Monsignor?
Amazing.
Great man. I want to thank, of course, Dr. Sherry Schachter for her interview, which really brought it back. You know, in the midst of joyousness, there's always going to be some grieving. Some people are going to have tragedies and deaths and so on. It's part of life, and she helps people to, and Calvary helps people to get through this. So thanks very much for all the great work you do. Now, for this episode, we have Dr. Daniel Stevens, surgeon at Metropolitan Hospital and the Bronx VA Hospital, and Dr. Anthony Saylor, pulmonary attending at the New York Methodist Hospital. Welcome. I want to thank you guys for coming in. Dr. Saylor, these two, by the way, I have to say it, the other guests on the show, please close your ears, the other doctors, my two favorite doctors in the whole world that are on the show, and you'll see why.
He says that to every guest.
No, I do say that to a lot of people, but I mean it tonight. This is what I really mean. Okay. Now, Dr. Saylor, what's good?
We just want to wish everybody a blessed Thanksgiving. A lot of stress and strain over the past few weeks, and our thoughts and prayers to all of our colleagues and friends who were affected by the hurricane.
You know, in keeping with that, the community and the hospital, they link together. They really are linked together. And at this past tragedy, that period, a lot of the workers at the Methodist Hospital that stayed overnight and helped in the hospital actually lost their homes. They have an event called the Red Stocking Soiree. It's the oldest event of its kind in the whole country. And it's an opportunity for those in the community to go there, to eat together with the staff, and also to help support the people who've lost houses. They're going to use that money to help people who are in bad shape. So I think it's a great opportunity. I know I'm going to be there. So it's called the Red Stocking Soiree. It's next Wednesday, the 27th or 28th, whatever that Wednesday, the 28th. And call up the hospital and ask about it. It would be nice to see you guys there. And Dr. Saylor, anything on pulmonary? How about this time of year, anything we have to worry about?
Well, obviously it's the flu season, so the flu is always a big concern. We like those above 65 or with medical conditions, emphysema, heart failure, etc., to be vaccinated. So it's very important in terms of maintenance.
Okay, and we also have Dr. Danny Stevens, who came in. You brought a little surprise that's in the other room.
Little surprise. We'll see.
You must stay tuned to the end of this show because there's a dramatic ending. That's all I want to say. It's a dramatic ending. Dr. Stevens, and we had a number of calls last week actually from obese patients who were asking about bariatric surgery, which is your specialty or one of your specialties. Anything changing with that? Are we doing it on younger kids? Are we doing it in less?
Well, there's several changes actually over the past few years. Yes, one is in adolescence. Bariatric surgery is becoming more and more accepted and more popular. The types of operations are constantly evolving and changing and waxing and waning. So there's a lot of new developments, and I think we're still doing a lot of good.
Good stuff. And diseases go away, right?
We're treating and curing diabetes, high blood pressure, sleep apnea. So
now we're going to, you know, everybody's got Thanksgiving wishes. What would be your Thanksgiving, if you can make a wish, what would it be?
Well, for me personally, you know, I'd like to echo Dr. Saylor's sentiments about the hurricane and what's been going on. But we all, I think, need to find things to be thankful for. And for me, it's, you know, my family, and everyone, I think, should have something to be thankful for.
Thank you. Well said. Tonight's topics again are lung disease and surgery. The number to call is 718-499-6101. You can also email your questions to askthedoctor@netny.net. We'll do a quick in the news because I don't want to delay. Can we do a little in the news? You like that, Dr. Saylor?
Yeah, it's beautiful.
This is okay. Hurricane looking below the surface, and I thought that was a witty way to look at something because most of the injuries, you see cuts, bruises, burns, and so on, yet what's the inside is what's going to be the biggest downfall, the biggest thing people have to cope with. We've seen that up to 50% it's estimated are going to have some kind of mental health disorder as a result of this event, from post-traumatic stress to insomnia to anxiety and so on. So the thing is to get in and talk about it early, particularly with children. So those who've had children who've had a loss, their home, even new people that died, talk to them about it. It seems to delay, or it seems to also make it less severe, these events that they go through afterwards, the anxiety and so on. So something to think about. Now another thing, Cracker Jacks. You love opening those Cracker Jacks and get the surprise? Yeah, I always love that stuff. Now there's another surprise. They're adding 70 milligrams of caffeine to each serving of Cracker Jacks. They're calling Cracker Jacked. Now it's not going to be, I don't make these up, okay? Go check Google. And what happens is they're adding this to an adult version. They claim they're not going to target kids, but I mean, kids are going to say, hey, Cracker Jacks, I want some Cracker Jacks. Kid eats, you know, get a 4-year-old that eats a couple of boxes. The next thing you know, he could be having a seizure. He's having, again, anxiety, hypersensitivity, and so on, and it could be a big problem. So the people are trying to get them not to do it, because where will it end? You're going to put it in Cheerios next or something like that. So it's something to think about. Hopefully you keep your kids away from that and the energy drinks that are out there with 7 cups of coffee in each bottle. And then another one, the pill that makes men faithful. Again, interesting story. How could a pill make men faithful? And there's a hormone called oxytocin. And what it does is, when you give it to a man, when he talks to a woman, he takes about a step back. He does it at about 36 inches. For the person who didn't get the oxytocin, he gets closer, about 24 inches. Seems that by being further away, there's less chance that there's going to be that amorous affair such as genital Petraeus. Whereas if you have the, if you don't have the oxytocin, you'll get closer and be more likely. Now that's why you have Kirsten so far away. You notice that? I was wondering why the people did that. But what do you think of that one? Not much? No, I don't think much of that one either. But those 3 are in the news. And now, Kirsten, tell us a little bit about the quiz.
Another reminder about the quiz. The question is, can you name the president who changed the name of the date, who changed the date of Thanksgiving to boost the economy? But my favorite part of the quiz is, we also want you to sing us your favorite Thanksgiving or Christmas song along with the answer.
And do we have any shout-outs?
Well, actually, we do have some shout-outs, Dr.
Yes.
Garner, as per usual. So today we want to give a shout-out to Karen Kushner and Eugene Freund in Brooklyn. We also want to give a shout-out to Peter Orozco and his lovely wife, Lana, and also Efron the doorman.
Efron the doorman.
Thank you guys for watching.
Yeah. And Peter Orozco. Remember Jesse Orozco, you guys? Yeah, he was a good curveball pitcher. A little on the slight side, but it was a good pitcher. Jesse Orozco. Anyway, let's get to why we're here now, the phone calls, okay?
Got it.
Kirsten, what do we have?
All right, we have Jana on line 1, and she's from Bed-Stuy.
Hi, Jana, how are you?
I'm fine. How are you?
Thank you for holding on.
You're welcome.
Are you enjoying the show? Not sure.
Excuse me?
Are you enjoying the show?
Yes, I was just listening to you.
Very good. And what's your Thanksgiving wish?
I'm just happy to be here another Thanksgiving and wish everyone well.
Thanks a lot. And what can we do for you? What question do you have?
Okay, I have sarcoidosis, COPD, and emphysema. Now, the emphysema and COPD, I don't have any symptoms. I don't really think that I have it. Is there any way of knowing?
Hi, well, first of all, happy Thanksgiving. I hope you're feeling well. It sounds like you're doing okay.
Yes.
Are you a smoker or a former smoker?
Never did.
Good. So, you know, you might be right. There is a chance that you don't have COPD, but sometimes sarcoidosis can sort of mimic COPD in terms of an X-ray or a CAT scan. So what I suggest you do is get to your doctor. I'm sure they know you never smoked, but you could reiterate that to them. And then perhaps a CAT scan and a breathing test, which is what we call a pulmonary function test.
I have had that.
You've had that. And
Yeah.
was it normal?
It was not normal, no.
So it was not normal. It may have been related to the sarcoidosis. So without having smoked, it's unlikely that you developed emphysema. Now, as you get a little older, we all get some emphysema. But the fact that you never smoked is wonderful. So what I would suggest is speak to your doctor, and the first question I would ask him are all of these findings perhaps related to your sarcoidosis?
Okay. Now, one more quick question.
Sure.
I'm also on oxygen. Do you think that would help the sarcoidosis?
Yes, well, sarcoidosis, the treatment is usually observation, or if it's treated, we give prednisone.
Yes, that's what I take.
Yes, so that's a very effective drug for sarcoid. In terms of oxygen, oxygen can help any lung condition. So if you have any pulmonary disease, such as emphysema, sarcoidosis, fibrosis, oxygen is a wonderful modality. So I would recommend you keep wearing your oxygen.
But you know what? Excuse me for cutting you off.
It's okay.
when I take, I take the oxygen with that oximeter,
Yes.
and it's always 95 to 98.
That's wonderful. So it's 95 to 98 probably when you're at rest.
At rest, yes.
Right. When you exert yourself, it likely goes down.
Down into the 80s.
Right. So for that reason, wear the oxygen specifically when you're exerting yourself.
I do.
And at night when you go to bed. If you're at rest and you have the oximeter and it's 95, 94, you can take it off for a while.
Thanks so much for your question. I appreciate it. We're going to move on and have a great Thanksgiving.
Thank you, and same to you guys.
Be well. Who's our next caller?
All right, we have Therese on line 2 from Bensonhurst.
Hi, Therese. How are you?
Hi.
How's things in Bensonhurst tonight?
Oh, it's pretty quiet.
Are you doing the cooking for this holiday?
No, my daughter's friend is doing the cooking.
Very good. And what are you most thankful for?
Well, I guess that we're all here, my family.
Yeah.
And, and pretty decent help.
Excellent. Just turn down the TV a little bit so we don't get that feedback. Okay, and what can we do for you?
Nothing. I wanted to do the quiz, and that, well, I did want to ask you a question after the quiz.
Okay, the priorities are straight here. I see. What's the answer to the quiz? Do you think the president?
I think it's FDR.
Okay, wait a second. The question was, what president pushed back Thanksgiving to have a longer period for people to go shopping? And you think it was FDR?
Right.
Was it FDR? Oh my! You're almost there. You're almost there. There's one other part to the quiz.
All right. What's the other one?
What are you going to sing to us?
Oh, over the river and through the woods to grandmother's house we go. The horse knows the way to carry the sleigh through the white and drifting snow.
Excellent. You fulfilled the.
That's enough. Is that it?
Now I have nothing left for the rest of the show. I'm done. We peaked early. I just
want to remind Therese really quickly, you won. You are our only trivia winner today. So we need you to send your information to our email address, which is askthedoctor@netny.net.
Well, can I tell it to you on the phone?
Yes.
Yes. There's one other.
I can't do email is what I'm telling you.
But anyway, there's one thing I got to tell you about that song.
What?
That person who wrote that song never had a grandmother, and in the song she wrote the words "Over the river to grandfather's house we go." But everybody picked up grandmothers.
Yeah,
It's interesting.
It doesn't sound right with grandfather.
It doesn't, right?
And I remember as a kid learning that in school.
Yeah.
And I think we learned it as grandmother.
Do you remember FDR?
Sure, I do.
Yeah.
I remember when this happened. Everybody was annoyed.
Everybody was annoyed.
When he changed the dates.
Kids were in school. They couldn't get their vacations, their football games,
Well,
everything.
why are you changing it for? It's no good. But anyway, then they went back again.
History.
I wanted to ask you a question, though.
Okay.
The pulmonologist.
Okay.
I read that certain type of pills for your eyes that have beta carotene in, that people who were smokers or are smokers, taking those pills, there was a correlation between them developing lung cancer. Is there any truth to that, or?
Therese, that's a great question, and happy Thanksgiving.
Thank you.
You're welcome. There's been a lot of debate in the pulmonary literature over the past few years about beta-carotene being possibly a cause of lung cancer, and there were even some studies that suggested it may be protective against lung cancer.
Oh.
The bottom line is that there's no real good evidence, so I would refute what they say that beta-carotene can cause lung cancer. And of course, for lung cancer, the #1 risk factor is smoking, so don't smoke to anybody because that's the main cause. But that's a great question.
Happy Thanksgiving. Thank you.
Thank you.
Take care. Dr. Stevens, I got to ask you something. This with laparoscopic surgery, why should the patient feel better about going in for laparoscopic surgery?
Well, there are a lot of benefits to laparoscopic surgery. Basically, what laparoscopic surgery means is you're making several small incisions and using instruments
instead of the knife to
instead of using a big incision. And the pain is much less, the recovery is better, your hospital stay is shorter. Basically, it's much less invasive, and there wound infections and scarring is all better than open surgery.
But I think one thing I want to point out, that you do so many, you don't want to just go to someone who's doing his first case. You want to make sure.
Right. You should, as with any doctor, I think you need to do a little research and make sure you're going to the right person.
Is there a way to know?
You know, you need to talk to people, talk to other patients, talk to other doctors. Word of mouth is very helpful, but you know, there's also the internet and things like that, which you have to be careful of. But it's, you know, you have to develop a trust. You go meet with your doctor, talk to him or her. If you feel comfortable, that's the most important thing.
Thank you, thank you. We got some of the phones are going crazy here. What do we have next?
Indeed. Well, it's our good friend Patrick on line 3.
Patrick. Patrick, how are you tonight?
How you doing, Dr. Garner?
How you doing?
Good. How's everything?
Okay, how's Big Vinny?
Big Vinny's sitting right next to me, Doc.
Ah, that's good.
Comes over every Tuesday. We have a little dinner and we watch the doctor.
There's a little bonding there. Yeah, I like
Yeah, a
that.
little bonding. Forget it. Doc, I want to ask the guy that does the laparoscopic surgery on.
Dr. Stevens.
Yeah, I'm overweight and I'm really, you know, I'm like over 300 pounds and I'm trying to lose weight, but I just never could see a way to do it. What would he suggest?
Hi, Patrick. So, you know, this is a great question. Do you have any medical problems, diabetes, high blood pressure, cholesterol?
I got to be honest, I haven't taken a blood test about a year and a half.
Okay.
At that point, I didn't, but, you know, I would think now, you know, I'm not really sure, to be honest with you.
Okay. Have you tried to lose weight by diet and exercise and things like that?
Yes.
All right. So what I think you need to do, Patrick, is number one, go see your regular medical doctor. That's the most important thing. You need to get some blood work, maybe be checked out for diabetes, check your blood pressure and things like that.
Right.
Number two, and in my opinion and most medical professionals' opinion, you should consider bariatric surgery if you qualify. So there are certain things that make you qualify. Basically, it's a measurement of your height and your weight. So you talk to your doctor. She can determine your BMI, which is the body mass index, and if you qualify, she or he can probably refer you to a bariatric surgeon, and depending upon your weight and medical conditions, you might be an excellent candidate.
Right. How long is that procedure? You know, how long does it take? I know you have to do stuff before.
It usually takes about 3 to 6 months until till the surgery, until you meet with your surgeon.
Right.
Roughly.
And you do that surgery, Doc?
I do.
You know what I'm doing? I'm going to get your number and I'm going to give you a call. Maybe I'll come in to see you.
All right. Very good.
Patrick, happy Thanksgiving to you. Enjoy, and a great year ahead.
Doc, listen, you guys are great. We're going to miss you. When do you come back on the air?
You got to write letters in. I'm not sure, but hopefully in January.
Oh, I hope so, Doc. We're going to be sick for 2 months without you.
Okay. Patrick.
God bless you, Doc. Thanks. Kirsten, have a good Christmas. You too, Doc.
Patrick.
Be well. Now we're going to try and move faster to try and get as many questions as we can in. So a rapid fire segment early in the game.
Perfect. So on line 1, we have Fred from Bensonhurst.
Hi, Fred.
Yes.
How are you? We're going to try and get these questions on quickly. What's on your mind?
All right.
Okay, this was not the right
Am I
call
on
to start
TV?
rapid fire, I think. But yes, Fred.
Yes. I had hip removal surgery July 10th.
I'm sorry, I missed it.
Which surgery?
Hip removal.
Oh, hip replacement, July 10th. I think the TV is confusing you.
Oh, all right. Let me look.
See if we can lower that. Anybody on hold, please lower the TV.
I'll lower the TV.
Thank you.
Yeah, I got it on July 10th, and I haven't been going to. I stopped going to physical therapy.
Pat, what's the question?
My question is that was that smart of me to do, or because I really didn't feel like it was benefiting me.
So you stopped going to therapy after the hip replacement. Is that a wise thing to do?
Well, you know, if your doctor recommended it, Fred, it's probably not the best thing to do. What I would do is try to get back into it, see your doctor so he could evaluate you and how you're doing. But even if you're not feeling immediate effects, it could be preventing bad things from happening, like degeneration of the new joint and things like that. So even if you don't feel an immediate effect and benefit, it still is probably beneficial for you.
Okay, and have a great Thanksgiving out there, okay?
You too. And one more about the laparoscopic surgery. Do they do that on the knees too?
It's called arthroscopic, but yes, basically it's small incisions. Yeah, they do that.
Small incisions to check out the damage that's inside the knee.
Yes.
Okay, thank you so much.
Okay, have a happy Thanksgiving.
You too. Thanks for calling the show. Kirsten, one more before the break.
Perfect. So we have Sharon on line 4 from East New York.
Hi, Sharon. How you doing? Sharon?
Yes.
How are you tonight?
Not good.
Oh, no, I'm sorry to hear that. What can we do for you?
I have a question about my heart.
Okay, Dr. Sale is ready to go. What's the
Okay.
question?
My son was killed on Thanksgiving Day, and I'm suffering from a broken heart, and I'm having difficulty breathing.
Oh, gee. So, Dr. Sale, you want to? Son was killed
Boy,
in.
I am so sorry, Sharon. My prayers are with you. That is a real entity. There is a cardiac entity, and of course, if Dr. Sacchi or Heitner were here, they would know more than I do, but there's something called broken heart syndrome, where your heart actually weakens from a severe stress like you've had. So,
And that's what's going on with me, and
I
as
know.
Thanksgiving is getting closer, I'm getting weaker, and I'm feeling more and more sick.
I'm so sorry. Was it last Thanksgiving?
No, he was killed in Europe. He was a professional athlete, a professional basketball player that played for the Harlem Globetrotters, entertained the troops all over the world, and he was killed in Finland by a drunken driver on Thanksgiving Day, which left me heartbroken and destitute, and I'm not getting any better.
Sharon, I am so sorry. You'll be in all of our prayers. Let me just medically tell you, I think the best thing for you to do is speak to your doctor. There is a syndrome called broken heart syndrome, and it's a very real syndrome, and Lord knows you've had enough grief. So accept our prayers and speak to your doctor. Hopefully, at least medically, they can help you.
And Dr. Saylor, one other thing. You know, we're going to see another short clip of the bereavement segment with Dr. Sherry Schachter. I would suggest you call her. This is going on a long time.
Yes.
I'm going to put the number up on the screen for you. I want you to watch the next segment with Dr. Sherry Schachter.
I will do that.
And I want you to call her. Okay?
I will do that.
Okay.
Take care.
You know, we feel bad, very bad. Tough one. That's a tough. So we're going to take a short break, and when we come back, we'll see the rest of the interview with Dr. Sherry Shackman from Calvary Hospital. The number to call for tonight's show is 718-499-6101. Our topics are lung disease, general surgery. And also email us at askthedoctor@netny.net. We'll be right back. Hi, I'm Dr. Steve Garner, and I'm back with Dr. Sherry Schachter, and we're going to talk a little bit about children and bereaving. And tell me about bereavement as it pertains to children. They lost a parent, a sibling. What do you do?
Children grieve very differently than adults, and we have a very large program both in the Bronx and in Brooklyn. We have started last year our groups in downtown Brooklyn at St. Joseph's High School. This is groups for children ages 6 to 11, and then we have our teen groups. In the summer, we have a summer camp. We had 75 kids this year, which was our largest ever.
How can we access this? I heard Kingsborough Community
College?
Yeah,
we actually held the camp at Kingsborough Community College, which was a beautiful campus.
So if God forbid a parent needs to call you regarding a child, who do they call?
They call, or they contact Calvary Hospital,
yes.
www.calvaryhospital.org. And we will set them up with our bereavement counselors in Brooklyn.
And Dr. Schachter, thanks for the great work you do and for making this available to
Thank
our
you.
city.
Thank you for having us.
Great to see you.
You are watching NET.
My mom's advanced cancer pain was eased only at Calvary.
My wife's dignity during her last days was restored only at Calvary.
I'm Frank Calamari, president of Calvary Hospital. We're proud to be the only hospital exclusively dedicated to helping terminally ill cancer patients and their families. Our expert staff delivers palliative care unlike any other hospital in the world.
Compassion.
Love.
Unparalleled.
You'll find it at Calvary.
It's where life continues.
and welcome back, where tonight's special topics are lung disease, surgery, and the number to call is 718-499-6101, and you can email us at askthedoctor@netny.net. And we're back, and that was a tough call, but hopefully you can take advantage of Dr. Schachter and the bereavement program at the Calvary Hospital. What do we have next?
All right, so next on line 2, we have Rachel from Manhattan.
Hi, Rachel. How are you?
I'm fine, thank you. How are you?
It's great to hear from you. What part of Manhattan are you calling?
We're actually calling from the Upper West Side.
Oh, not bad. How far up?
Around Midtown. I'm actually calling with my 2-year-old son who's a big fan of the show, and he wants to say Happy Thanksgiving.
Oh, let's hear it.
Happy Thanksgiving.
Oh, Happy Thanksgiving. We'll give you a big round of applause.
I have a question actually. For the pulmonologist.
Yes, Dr. Saylor?
Yes, I have been having a cough every winter, and it comes on, as soon as the weather gets cold. It's like almost constant. I've tried nasal irrigation. I've tried a steroid nasal spray. Nothing seems to help. It's just a constant cough, almost like a post-nasal drip. Is there anything I could do for that?
Sure. Well, first of all, your son is adorable.
Thank you.
Cough is a very common symptom. We see it all the time. You're not a smoker, I imagine?
No, I hate smoke.
Great. Okay, and you stopped. That's great. So in terms of your cough, there's a whole gamut of causes of cough. The 3 commonest causes are postnasal drip syndrome, which sounds like you might have that, GERD, or what we call reflux, and finally asthma, or asthma that may be a little harder to diagnose. Those are very common. Some other common causes are patients who are on medications for high blood pressure or the heart. You're not on any medications?
No.
Great. So it sounds like your cough may be allergic. The nasal steroid sprays sometimes help, but what I would suggest, go to your doctor. There are certain pills that may help prevent the drip, and there are certain sprays that if your bronchial tubes are inflamed, they may help. So the fact that it occurs yearly at the same time suggests some allergic component to me.
All right, thank you very much.
Thanks for putting your son on. That was amazing. Thank you.
Thank you. All right, bye.
Bye. Who do we have next?
Iris on line 1 from Astoria.
Iris, how are things in Astoria?
All right.
You've been waiting a while. Thanks for being patient.
You
He's getting
should
annoyed
the
with me.
question now?
Yes, what's the question?
The question is, my husband has emphysema, and I think he has sleep apnea, and he's like over 300 pounds. And it's not working, the medicine. He doesn't go out that much, and he can't breathe that well, but he won't go back to the doctor.
Tough. Okay. How old is he?
He's 61.
61, young man.
So the fact that he has trouble breathing, there are lots of causes. Perhaps his weight is part of it. In terms of sleep apnea, while initially the treatment is a mask and he should have a sleep study, I'm going to defer to Dr. Stevens because I think sleep apnea as well as his breathing may indeed be improved, as well as some of his other medical conditions with bariatric surgery. Dr. Stevens, why don't you comment on it?
Iris, you said he was over 300 pounds?
Yes.
And how tall is he roughly?
But he also has schizophrenia. He takes medicine for schizophrenia.
Okay.
So
How tall is he about?
about 5'11".
All right. So, you know, he sounds like he qualifies for weight loss surgery, and it's something you might want to consider, or at least talk to your doctor about, if the medical problems like the sleep apnea, the emphysema are concerning, which they are. The weight loss definitely will help. He needs to lose weight one way or another. It's going to help his sleep apnea almost 100% and prevent and treat any other medical problems like diabetes that he might have. So you really need to go see your doctor and at least have a discussion about surgery.
Thanks so much for the call, and have a great Thanksgiving.
You too.
Be well. We have our last caller of season 17 coming up. Who is that?
Oh, wow. Well, it's Craig on line 3 from Canarsie.
Hi, Craig.
Yes.
Hi, how are you in Canarsie?
Okay, I have a question. Like last year, I went through a lot. I had 2 surgeries within 3 days, and 3 days after that, they tried to stand me up, and I had a pulmonary embolism in my lung.
Okay, so we're going to talk about pulmonary embolus. Dr. Saylor, you want to?
So, Craig, that's a very common problem postoperatively. First of all, you feeling better?
Yes, but the story is now I have a hernia which has to be operated, and the surgeon wants me to see a lung specialist before he would do it. Like, he kind of scared me. He said that he doesn't want to put me to sleep without a lung doctor's okay, because I might not wake up.
Craig, don't be scared. You will wake up. This is very routine. How long ago was the blood clot?
Oh, it happened maybe a year ago, like last November.
Good. So you're not taking any more blood thinners, correct?
No, I was taking Coumadin for a while, and they took me off it.
Good. So, Craig, I think your risk will be very small. You should see a specialist just to have a breathing test, make sure your lung function is acceptable, but do not worry. You're not at a high risk, and I think you'll fly through the hernia surgery, okay?
Be well. Have a great Thanksgiving.
Okay, you too.
Take care. I was wrong. I have one last call. So this is the last call of the 17th season.
Perfect. Okay, so we have Catherine on line 4 from Diker Heights.
Hi, Catherine.
Yes.
Beautiful golf course out there. What can we do for you?
Hi. I'm on? I'm on.
You're on the air.
Okay. I have a couple of problems.
Well, we only have time for one.
Oh, okay. What I want to, ask you is I'm on 3 different kind of medications for the lungs.
Okay, we're
For
gonna.
the lungs. I'm on Symbicort, I'm on Singulair, and I'm on the nebulizer, the Ambutol. I'm still having a lot of breathing problems. I go on the nebulizer twice a day. Also, I don't
What's the
mention
question?
that
Because we got to move on. What's the question?
what I want to make sure is I also have stage 4 lung breast cancer, which traveled to the lungs, and it's on my nodules. I don't know if it's coming from the asthma, this breathing problem, or is it anything to do with the nodules that I have?
Okay, let's hear what Dr. Silla has to say.
So first of all, I hope you feel better. It could be either. It could be asthma or the lung nodules. Your medication is very appropriate. Symbicort is an appropriate medication for you. Singulair is appropriate. If you need the nebulizer, what I would do is check with your regular physician, tell them how often you need the nebulizer, and perhaps there's something that can be added, okay?
Right, because I'm still suffering with the breathing.
Right. So see your doctor, and I think that'll be beneficial. Tell him, and hopefully you can feel better.
Okay.
We wish you the happiest of Thanksgivings, and be well.
Thank you. You do the same. Thank you, doctors.
Thanks. Now the time has come. For those who have stayed tuned, they're in for a treat here. It's amazing what you're about to hear. We have an opera singer who happens to be a dentist who's a big fan of the show. He saw the show, and we gave a call to see about being on as a dentist, and we took him as an opera singer. Not to say his dentistry is not good, but we were all booked up. What we're going to do is introduce Dr. Jim Kazukian, and he's going to, it reminds me of Goma, not that you look like Goma Pyle, but remember Goma Pyle would talk like a normal person, and then he'd start singing, and you say, how could that be coming out of this person's mouth? You got to be prepared for this thing. So Dr. Kazukian, it's welcome to Ask the Doctor.
Thank you, Dr. Garner.
Was it everything you thought?
More so.
More so. And once he sees we had a lot of confusion around Dr. Saylor, Dr. Stevens running around, Kirsten running around, our producer running around, Teresia, and we want it to go well. So just tell me, how a dentist, how did you become an opera singer?
Actually, this was a gift from my wife. She gave me, before we were married, singing lessons.
So without further ado, I'll do my best. I want to introduce Dr. Jim Kazukian, who will sing.
It is part of excerpt from Mozart's Magic Flute.
You're on the air.
Within these holy portals, revenge remains unknown, and to all erring mortals their way by love is shown, and guided forth by friendship's hand, they journey to a better land. And guided forth by friendship's hand, they journey to a better land. and guided forth by friendship's hand. They journey to a better land, a better land.
One of the most amazing things I've seen on the Ask the Doctor show. Amazing job. Really beautiful.
Wonderful.
It leaves you
Very
speechless after that.
good.
I hate to ask you, but at the end of the show, we're going to be singing a little bit. Would you join us?
I'll try. I'm not familiar with the pieces, but if I can lend a little bit of a voice, I will do
That's
so.
when did you realize that you had this gift?
You know, all through back in college, during the fraternity songs and whatnot, it seemed as though I was always asked to lead. And I really wasn't trained at that point, and I only took lessons to hone my karaoke skills a bit. Little did I know that I would go into the classical division.
Well, I can't thank you enough. You're going to stick around, and coming attractions for next season, you're going to be a guest on Ask the Doctor regarding dentistry.
I look very much forward to it.
Thanks again. It was fantastic.
Thank you, Dr. Gardner.
And now that we've heard the opera singer, I hope we were in a singing mood. What was your song around the table at the Saylor household growing up? What was the song?
We were big Sinatra fans.
Ah. So what song? What would be a great song to?
So Send in the Clowns was a big favorite. Dream Away. My daughter will kill me for saying that, but
Dream Away.
Yes,
yeah,
you got it. Yeah.
You ever listen to Jonathan Schwartz?
All the time.
Great show.
He
Anyone
is
has
phenomenal.
Yeah.
Phenomenal.
And at the Stevens house, I understand there were how many Stevens were there?
Too many of us.
There were a lot of Stevens.
I'm one of 9 kids. I'm youngest of 9.
One of 9 children.
Yeah.
Harvard trained. Excellent. I don't want to embarrass him, but he's modest.
True.
What did you sing at the Stevens household?
Yeah, we couldn't get a word in edgewise, you know. We were just eating, that's all.
Yeah. We used to like to sing patriotic songs. We'd sing God Bless America, and so at the end of the meal, everybody would get up, then smoke a cigar, which I don't want anyone to do. We'd go up and play pool on the 3rd floor. That was yeah. So who's making it this year? Is your wife making the holiday, or?
Yeah, we'll have it at our house.
A lot of work. This is a lot of work.
Yes.
I'm leading up, by the way, for those that don't know, I'm leading up to this guitar. Dr. Stevens, do you happen to have the guitar with you?
It just so happens that one is sitting
you never know
behind
what
me
you're
here.
Wow.
You never know what you're going to find at Ask the Doctor. So how are we going to get in the spirit? Kirsten, get us in the spirit.
In the spirit? Well, let's see. I don't know. What was that song that the caller sang earlier?
But before we did that, we gathered together to ask the Lord's blessing. This was sang in all the 16th century Dutch homes. So we ask the Lord's blessing. He chastens and hastens His will to make known. I think that's a nice song because it shows our thankfulness and so on. But Dr. Stevens, without further ado,
this is familiar,
I want to just give this to
guess.
Dr. Saylor.
I will need it.
And Jim, you're over there, but we'll help you out with that. Okay.
All right.
Over the river and through the woods to grandmother's house we go. The horse knows the way to lead the sleigh through white and drifted snow. Oh, over the river and through the woods, oh how the wind does blow. It stings the toes and bites the nose as over the ground we go. Everybody, over the river and through the woods to grandmother's house we go. The horse knows the way to carry the sleigh through the white and drifted snow. Over the river and through the woods to grandmother's house we go. The horse knows the way to carry the sleigh through white and drifted snow. Whoa!
Well done.
I feel like a piece of turkey now. It's like a little food. That was Dr. Stevens' excellent job here, and that's under intense pressure. Excellent job. Well,
job singing.
I don't know what that signal is. I get different signals from our producer. And I know some of them, but not the ones you want to hear on the air.
Well,
so,
I have to say personally, Dr. Garner, I'm so glad to have been a part of this season. Thank you for welcoming me.
Thank you for coming on. And you beat out, there were many, many people who actually applied for this position.
Yes, I feel extremely blessed because it was so wonderful to meet all of you.
Here's the clip. Are you coming back for next season?
Well, I would love to.
Okay, let's see what I can do.
Okay, pull a few strings.
Jim, you're coming back?
I am.
Okay, he's coming. And Dr. Saylor, final Thanksgiving wish.
Again, our thoughts and prayers are with all of those affected by the hurricane, and try, everyone, to draw something to be thankful. And I think we all have something to be thankful, something big, something small, but in the wishes of the holiday spirit for Thanksgiving, enjoy a blessed Thanksgiving, and we all have something to be thankful about.
Dr. Stevens?
I couldn't have said it better. Be thankful for something. There's something in everyone's life.
Yeah, and I'm thankful for parents because that really sets you up. Your parents really set you up for life. You watch them, you watch how they behave. So it's so critical. It's like careful the things you say, children will listen. But it's more important, I think, what you do that they're looking to see. I don't know, it's been great doing Ask the Doctor for 17 seasons. We look forward to the 18th season. We have favorites. We haven't heard from Grace tonight and Rosemary.
And Joe Stiles.
Joe Stiles didn't call tonight. Maddie didn't call tonight. But it's great to have some newcomers and people that have been with us and become part of the Ask the Doctor family.
We're thankful for them.
Yeah. And you'll be able to watch at 9 o'clock tonight last week's show. And going forward, though, I noticed we're not on during the week. So, again, write those letters and let them know, let the station management know you want us on, you want to Ask the Doctor on. I see Jim saying hello. And I think
I would like to say we're thankful for Dr. Garner. You know, I think not only do you do a phenomenal job with this show, you know, you're like the Letterman of doctors, but you also are a tremendous doctor working with you so closely in the hospital. You put your heart and soul into everything you do, and I think the only thing you do better than being a doctor is being a person. So we're thankful for you.
Thank you very much. Dr. Stevens, I'm going to ask if you would, as we do roll out and I do my final speech, can you please?
Sure.
Well, that's it for this episode. This was, I mean, I got to go home. I'm not going to be able to sleep tonight. And the end of season number 17, I can't believe it. I want to thank Kirsten Elizabeth for adding something to our show, a little bit of youth, and also for representing a different generation that joins Ask the Doctor.
Pleasure.
Monsignor Bennett, who's been so loyal over the years, and the main reason I said we're here. I want to thank Dr. James Kazukian.
I look forward to becoming one of your favorite doctors.
Yes, it doesn't happen overnight, but eventually. And Dr. Anthony Saylor and Dr. Daniel Stevens, again, my two favorite guests for coming in. We hope we're able to help you. It's good to remember, go for first, second, and third opinions. You got to be proactive. You know, and if your doctor doesn't like you going for a second opinion, get a new doctor. And you want to join in on our website, askthedoctor@netny.net, and you'll get to see previous the tablet columns. You can watch previous episodes. I want to thank you all for your calls and emails. We got all over the world this year emails, and it's great meeting you at that church event. I hope we can do another one in the winter. And as we get into the Christmas season, let us continue in keeping family, friends, and neighbors who were affected by the Superstorm Sandy in our prayers and our celebration. Now we invite you to join with us to sing a few verses of well, we won't do We Gather Together. Let's do We Ask the Lord's Over the River and Through the Woods, because that's the only one we know. Okay. Over the river and through the woods to grandmother's house we go. The horse knows the way to carry the sleigh in the bright and drifted snow. Oh, over the river and through the woods to grandmother's house. It swings the toes and bites the nose as ground we go. Oh, over the river and through the woods to grandmother's house we go. The horse knows the way to carry the sleigh through the white and drifted snow. Oh, over the river and through the woods to grandmother's house we go. The horse knows the way to carry the sleigh through the white and drifting snow.